Hi Jokers, thanks for watching this episode of Jokers Physiotherapy. Today, it is all about a stiff and, more importantly, painful jaw to open. So if there is a stiffness or end of where the limit, you have pain and you can't fully open because of the pain. So if that's the case, as a general rule, you guide yourself through any which way possible to move your jaw in the direction and the combination of movements of the jaw that is relatively pain-free. So this is, you never push the jaw in different directions unless it is relatively pain-free. What does relatively pain-free mean? Let's say if the 0 is no pain and 10 is the maximum pain, then you would only gently go to, let's say, 3 out of 10, and 10 being the max, 0 being no pain. So yes, so jaw has 3 different movements. 1, obviously the opening, and 2, right side, left side. And lastly, 3-dimensionally, forward and only a little bit, but backwards. So jaw moves in combination of 3-dimensional movements. What that does is bottom teeth meets the top teeth. The bottom teeth are just sitting there and not moving, and the bottom teeth are grinding using 3-dimensional movements. It's not doing that. These are the top and the bottom teeth. Top teeth are fixed, bottom teeth through the jaw movements, grinding the food material. Okay, so we're simulating that movement to try and get some of the range back with minimal increase in pain. Okay, you never push into the pain. This is the early stage of a painful jaw. As you are starting to recover, you do what we call a round the world jaw exercise, where you could combine in any movements possible, namely open, sideways or forward or backwards. And let's say, for example, if it's not painful to go forward, you go forward first. Forward. And then if it's not painful to go to the right, you go to the right next. Sideways. Okay, cool. It's still not too painful. Then you go open. And then you might go to the other direction while you stay forward and open. To the left. And then come back. And then go back to your normal bite position. Okay, so that was forward to the right, and then did we go open and then go around to the other side and then come back and then pull back. So let's do a different combination. Next, you might go to the right. Okay, not painful. Let's go forward, then stay sideways and then forward, and then finally open. If it's painful, that's all you're gonna do. You only go to maximum of 3 out of 10 intensity of pain. You never push beyond 3 into 4, 5, 6, 7, 8. Too much. Stay 3, and that's the range you're gonna get. But you gently repeat within the comfortable range in whichever way possible. Keep your jaw moving, and over time, you might repeat that 5 times, 10 times if it's tolerable, unless those combination as you repeat them randomly increases pain where it was below 3, but when you did the 3rd and 4th and 5th time, it was increasing beyond 3 into 4, 5, 6, please stop. You might find another direction or combination, maybe go backwards. I'm not saying that is going to be less painful, but you're gonna gently trial and find a pain less or pain-free movement. And maybe you go to the left, okay, it's less painful, and then open. Once you open, you try and go the other way, to the right, come back, and then backwards. Okay, so what we want to do is to regain relative pain-free movement as much as possible, because if we can regain a relatively pain-free movement first, that will definitely help improve over time the movement of the function, which is opening and closing. Especially opening and closing, especially opening is painful and closing is also definitely painful with chewing and things like that. Doing them gently and slowly are the key components of improving. So because it's painful, staying still, yes, it may help settle things down, but it may not improve the overall movement of the jaw joint. The jaw joints are one of the most used and moved joint around the body. If you can think about it, we may be talking all day, depending on your profession or what you're doing, and then have 3 meals a day, let's say. Each meal you might be chewing, say, up to about 2,000 times. 3 meals, 6,000 times, yeah? Or well, not this way, around grinding, and then talking. So we are using our jaw to some extent, hours and a couple of hours at least every day. Now, would you walk a couple of hours? Maybe you do every day. Yeah, so it is one of the most used parts of the body. So let's keep them mobile and gently improve if it's significantly painful. Now, this is just a general video and education purposes only. So please seek your own professional help if you're in extreme pain. Make sure you see your doctor first. Okay, but if you like this video, please give us thumbs up, or please subscribe for the future videos. Okay, thanks for watching this episode of Joker's Physiotherapy, and happy rehab. Cheers!